But I do want to say hello to everyone once again. And the topic of today's talk is how to effectively communicate with your cancer treatment team. Now, I am a nurse practitioner with public health background, and I am currently the cancer program coordinator at Los Robles Hospital. And this is our hospital. Many of you may be familiar with that. We are a 382-bed hospital, and we have just gotten city approval for us to open a cancer center, which will be off Rolling Oaks Drive. Look for things in 2025 or 2026. But I'm happy to say we will have a more comprehensive approach in our community. Now, when you're looking for a cancer center, you do want to see if there are accreditations that are available nationally that I think make for a better center overall. So you want to ask wherever you're going if there's a breast accreditation, a Commission on Cancer accreditation, and of course, we belong to the National Consortium of Breast Centers. There's 800 centers around the country, and we are also a breast imaging center of excellence. So these are the kinds of designations you may want to look for when selecting a cancer program. But the patient and a navigator is a person, generally a nurse, who is associated with the cancer care team. And they're the ones that kind of are the center of your world when there's a cancer diagnosis. And they interact with all the members of the team, including surgery, primary care, radiation, chemotherapy, if any of those things happen. And then secondarily, they also keep in touch with case managers, social workers, pharmacists, and we couldn't do work in the community if we didn't have the cancer support community who are helping us with support and other programs that keep people in the moment and functioning as best they can through the treatment continuum. So navigation is really helpful when people are confused, they get multiple opinions, they don't know where to turn. A navigator can generally direct the family to resources, and they never make recommendations about doctors or treatment, but they are there to help you place things in a certain order for you to more easily navigate through a very complicated healthcare system in the United States. And it's kind of a mess. I mean, when you look at all the things that need to happen to stay well, with exercise, with nutrition, with testing, with labs, consultations, this really gets to be overwhelming. And when you're not feeling well or you don't have family nearby, this becomes really overwhelming. So hopefully here's a few things that we can direct your attention to when the patient becomes the center of the care. Everything is based on what the patient's needs are. We want to ask what the patient's expectations of care are, and we want to respect those different kinds of conversations that are going to come up through the course of treatment. So the concept of a patient-centered care, for those who may not be aware of the term, it's collaborative, it's coordinated, and it's accessible. And that's why we're really lucky to have many different facilities that we can draw on expertise all through the LA area. So we're luckier than most when it comes to other more remote or rural areas that don't have access. But the care is focused on physical as well as emotional well-being. So it's a holistic approach to everything about the patient's needs, taking into account the family preferences, there's cultural traditions, and also insurance needs. And patients and families are considered part of the team rather than someone who just sits back, listens, and passively just takes directions. So the patient and caregivers are usually fully educated on the medical condition and processes so they can make informed decisions. And I can tell you, being in the field for many decades, even when my grandfather was very ill, I remember this clearly. It helped direct my career. I was 12 years old when he died of bladder cancer, but no one ever talked about it. No one ever said the word. No one ever got involved in the care. And I'm very sure that the patient knew that this was a long and complex diagnosis. But in those days, it was just easier if the patient didn't know and family worked behind the scenes. We want to bridge that gap and we want to make conversation and collaboration better so communication is better, patients understand their treatment, their options, and all accredited breast centers, as I said, do have a navigator as part of their team. So if you haven't been introduced to one, I urge you to ask your cancer care team who is the navigator, who can be my navigator when you have questions. So the navigator role again will help in the continuum of care through all these things I've listed here. They can help with workup, pre-treatment, making appointments, and end-of-life conversations. So this is how we plan different conversations and weekly meetings with all the members of a cancer care team so that we know we have support from administration and we have effective implementation of the programs we choose and we offer measurements and standardizations with quality assurance, quality information so that we know that our programs are effective. So if you're in a center where you're not seeing all of these connected Venn diagrams, you do want to ask, where do I fit in and what are these different touch points that we can have for our care? And I thought this was interesting, and it's just from August of 2022. I don't have anything more recent, but if you take a look at the respondents when they're asked how healthcare is handled in the United States, you can see nobody really feels that this is effective. So when you say not too well or not at all, take a look at these numbers. They're anywhere from 48% to 74%. That means patients are unsatisfied, they're not getting their needs met. And for all these different things, whether you're living privately with help at home, in a healthcare facility, or with community support, most patients are just not satisfied at all with the care that they're getting. So when you're self-navigating, meaning you're getting to appointments, you want to keep good notes and you want to have a plan to handle bills and payments. If you designate somebody to help you with that, or organizing your bills in QuickBooks or on computer programming, or even if you have a financial planner or an accountant or somebody good with numbers that can help you organize these things, because the paperwork alone and all of these statements of your care and what you owe and what copays are, they get very tedious, complicated, and confusing. So there are some financial nonprofit organizations that can help pay for treatments. It's important you ask for these things. It's very difficult now, pre and post pandemic. The changes are very, very troubling because there's not a lot of monies available to help patients, but through grants and other organizations that can fund a patient individual monies to help bridge a gap, that's going to really alleviate a lot of stress. So when you're transitioning through the cancer journey, you do want to know about side effects and what you need to know about possible recurrence. And you really want to know about social and financial and workplace situations. You can't handle all of this in the midst of treatment. You really do need to ask for help. There are people within the cancer care team that can address some of these issues. So how to find a cancer care team? You might want to start with a primary care physician if you have somebody in the community that can make a referral for you. Or a lot of people get recommendations from friends, family members, or other people that you trust that have been in the same situation with the same diagnosis. You can call your healthcare insurance company and customer service line and ask for local specialists in your network, or search online, but do search on reasonable links, because sometimes you just get down that rabbit hole of people who have all the best intentions and really don't help you search online for appropriate referrals. So I usually stick to things like the American Cancer Society or the National Cancer Institute, which can help you sort out who are the best people in your community. Now, when you're talking to the team, a doctor wrote a book not long ago, and it was called Making the Diagnosis in 2 Minutes. And it's really true. If you go into a doctor's office and you're given a 20, 30-minute appointment, if you're lucky, they're making up their own minds about what your needs are within the first 2 minutes of your conversation. So I think it's important you express yourself clearly about symptoms, side effects, when a symptom started, what kind of testing have you already done, and please write things down when the healthcare provider is talking with you, or ask if you can record the visit. A lot of people don't know that some physicians don't mind a recorded message, but again, you can take it home and listen to it again later, or bring somebody with you, because another person hearing the same information when you're nervous sometimes can help you fill in the gaps where your attention may have been drawn other places. And to ask as many questions as you can. It's the questions are not silly. We who work in the clinical field, we've heard many of the same questions many times, but each individual patient is going to be different. And we do want to talk about your specific needs, even if the question seems really to make no sense to you. So anyway, I can't emphasize enough that communication goes both ways, and someone needs to respect your story in your voice. And if you're feeling rushed, you got to ask somebody to slow down, because you need to hear this more than once. So what kind of questions do you want to ask? Well, you can start basically with, what's the type of cancer I have, and can you define what stage I may be at? Some people get confused between stages, which in most cases are stages 1 to 4. And then there's other stages in between, such as like 1A, 3B. There's subcategories of these things, and it can be a little confusing when you're talking in, medical speak. So ask again about these kind of questions of staging. What kind of tests or procedures will you need? Where do I have to go for these tests? Can some of them be done in the office? Do I have to go to the hospital? Is there a special center I need to attend? How fast will I get the results, and who am I going to hear from? And who will be part of my cancer team? So if I need a second opinion, many patients think that we're going to be insulted if you're going to ask for a second opinion, and that's not true. We know that people want to hear from more than one specialist, and that's okay. But if you do need a second opinion, will you need to have any of your tests repeated? And I can say sometimes other opinions want different testing or want to review your testing. So I always suggest, when you get a test result, or your doctor or the office talk to you on the phone about a result, always ask for a copy of this test. Now, some places now have portals and patient portals. You can go in there and you can see all of the test results so that you can see the actual report. But if there's not a portal and you're relying on your own records, you never know. The doctor could retire, you could move. It's important that you keep copies of everything you've done so that everybody can see where you were in the process when the diagnosis was being made. Now, cancer care itself can be rather complex. So what kinds of treatments are available for my type and my stage of cancer? And where can I get more information? And what are the benefits and risks of each of these treatments? And It's important to know what the benefits are, what the risks will be, and what are the treatments being recommended by the person you are consulting with. And why do they think that's the best treatment? So, start dates, length of treatment, how will I know if the treatment's working? What kind of tests or follow up or individual kinds of follow ups will I need? And almost nobody asks the question about clinical trials, but we're lucky in this community to have both a City of Hope and a UCLA satellite offices from the main campus in Duarte. And there's lots of clinical trials and research studies that may be right for you and may, in fact, help in ways you wouldn't know by traditional treatments. So if a clinical trial is available, or if it's not mentioned, mention and see if there's something that the consultation, the physician could recommend that might make a difference in the overall survival benefit. And will I need to see specialists or specialists? How many? Sometimes everybody is categorized by the type of cancer, the stage, and then typically there's a surgeon, a medical oncologist, a radiation oncologist. Those are the three basic specialties, and then you might have other things, physical therapists, social workers, support groups. But the specialists for treatment are generally either surgery, chemotherapy, radiation, or a combination thereof. And that's really an important thing to keep in mind. And will the doctor find a second opinion for you on best treatment plans? I know some doctors, even when I call on behalf of a patient, will say, you know, I really like this person. They live, you know, their office is close to the patient. They may want to check on an opinion with them. But don't forget the other special valuable members of the team. I mentioned dietitians, psychologists or psychiatrists. There's rehabilitation specialists, and that's usually occupational or physical therapists, oncology nurses, oncology social workers, case managers, genetic counselors are often part of the team, whether they're in the actual facility or by telemedicine. And then generally speaking, when you have all of these people, the medical oncologist is generally the captain of the team. So if there is a medical oncologist, they're usually coordinating with others on your behalf. But don't forget the pharmacist. I know we think we pick up medications from there and we generally get a small consultation about the medication itself and potential side effects, but the pharmacist is a wealth of information. First of all, they know all of the discount plans. So when you go, you might find out that there's some plan that may help you afford some of these medications, but you could ask, how does it work? And what happens if I miss a dose? And how much does my prescription cost? How much is my insurance going to cover? And should I take this with or without food or water? Or what are the possible side effects? And what are the ones I should really be willing to tell my doctor about? And is there any copay insurance available? Pharmacists, even in small oncology practices, or if they're at the bigger chains, they're going to know this information, and it's something really important to help you make decisions. So here's some guidelines that I think are helpful for office visits. Before your appointment, you want to prioritize your concerns. If you have a list of questions, put the most important ones that trouble you at the beginning. Because as I said, doctors are listening in the beginning, but they're already formulating a plan as you go further and further down your list. So you want to make a list and you want to prioritize what goes on the list. And have any of your procedures, any of the dates and locations of anything, you've probably filled out a patient history form, but you do want to make a list of your doctors, their addresses, their phone numbers, and let your doctor know what happened since your diagnosis or since the last visit. Bring a list of all your medications and have somebody go with you for support if you can. And if you have any lab or diagnostic paperwork and follow-up that's happened, bring those too, and make sure they know who your primary care physician is. So these are all important even before you set foot in the office. Some of these things are handled by phone by the specialist staff. And then you want to have as much comprehensive information as you can bring with you. That's also going to help prevent you from having to repeat tests that you know you've already completed. I think it's important to keep a journal, and some people keep journals on their feelings, emotions, what's happening. They write letters to their loved ones. But I think it's important to also include your side effects. When did it happen? When did it start? How long did it last? And, on the pain scale of 1 to 10, where would you put pain if that's part of a side effect? And what impact the side effect has on your daily living. So, can you sleep, or you're having trouble walking, working, concentrating? You may want to include these in a journal so when you're back seeing someone again after the next available appointment for you, you've got a list of things that make sense that can be a touch point for the conversation to start on how are you going to mitigate some of the side effects you're experiencing. Oops, sorry. Questions to ask about cost. Sometimes there's a copay, or you haven't reached your out-of-pocket expenses. When is payment due? When would you get a bill? And if I have multiple visits, is there a way that I can, pay the copay only once and not each time? Do you offer payment plans? And does my insurance cover such things as second opinions and other blood tests, procedures, x-rays, etc.? So most offices and staff should be able to help you with this. And if they usually have some financial or billing expert in their office or billing service you can call, ask for advice, ask for information on any of the things about cost. Here again, when you're talking about insurance issues, so who's going to handle these in the office or the medical center? Or do you have to call an outside 800 number to someplace out of state to talk to someone? And is that person going to be the one to help me with insurance and paying providers? And who will figure out my medical bills or codes? Many times when we started coding, this goes back into the 70s and 80s, I think. The code book was very small, very small. Now there's over 10,000 codes, and there are mistakes that are made in coding which can affect your out-of-pocket expenses. So if the claim is denied, who's going to help me file an appeal? Because it may be that the code was wrong, or it may be that there's something you didn't understand in the procedure itself, or you didn't reach your deductible yet. I think these are important questions to know because insurance can make the difference between what is paid and what is left over that maybe you can find financial help with. But first, double check to make sure coding is correct. And I ask the question sometimes, are you sure the code is right for what you billed? So double check with your insurance company before you go to an appointment. Sometimes you want to make an appointment that's in network, but let's say the network doesn't cover the specialty you need. Then can we make an appeal to get an appointment out of network, but not be a burdensome cost to you? So, not 10,000 codes, 70,000 codes are used in billing for procedures, particularly in oncology care. Now, some people don't know this, and I don't think a lot of people in medical facilities share this, but if you can pay cash for a procedure, let's say an MRI, for example, you can save up to 50% discount on the cost when you're paying cash. So don't be afraid to ask, if I were to pay cash, what would my fee be then? Because sometimes you're astounding to find out that the cost is much less if you're paying in cash. These tests are expensive and cash is not that easy to come by, but if it's something that has a cash value, be sure to ask about it. They'll have to tell you that there might be a separate cost. and a discount for that kind of payment. So there are a lot of insurance companies that love to deny care immediately and hope you'll just give up. I've had this happen to myself with an orthopedic problem when I had back surgery. So don't give up. I have appealed something as many as 3 or 4 times. And eventually we do come to some kind of agreement. So even though you may get a first denial, have the billing office or the medical facility or someone in financial planning or financial assistance that can help you with an appeal, because this can sometimes change the tide for you. If you give up right away, then you're stuck with these rather large bills that maybe could have been changed. And look for alternative drug prices. That's where the pharmacist comes in. There's GoodRx, there's Single Care, Visory. These are all apps you can put on your phone. And even though I'm on Medicare and have a Plan D for drugs, I use all of these to look up my particular drug. And sometimes I spend much less than even the drug plan I pay for. So take a look and see if there's medication that you can get at a better price just by asking the pharmacist or going to these applications. Now, I once had a case at the City of Hope, and this person came from the Middle East, from a very wealthy emirate country, and they paid for everything in cash. Most of us don't have that kind of expenditures and monies put aside for such big expenses in healthcare like this. But it's important to know what is the total cost and what is recommended as a possible payment plan. Or does my health insurance company need to approve every test I do before I just make an appointment and do the treatment? And is my treatment center in my plan's network? And if it's not, do they offer similar kinds of procedures and care? What expenses does my health insurance cover if I'm treated as an outpatient elsewhere? And are there any ways to change my treatment schedule so I can work around things like work or childcare? I know many patients who have had radiation treatment for breast cancer. They'll make their appointments either the last of the day or the first in the morning so that they can either arrange childcare or arrange to be at work, or now we have more options for remote health care. Sometimes it's just a better time of day than just being accepting of whatever appointment they can give you. And if it's the middle of the day or around school time or a place where you just are going to find this burdensome, then I think you need to speak up about what is in your best interest. And how can I get low cost or free counseling to support me? And again, our partners at the Cancer Support Community do a tremendous job for everyone in the community who needs support, a network of like-minded people with similar diagnoses. These are where your support comes from, particularly for those that don't have family nearby. And I might add that the Cancer Support Community also has support groups for families or children so that everybody can learn from the experience and work together. Again, when it comes to cost related to care, it can be very expensive, and many people have unplanned expenses related to their care that they never thought about. A second biopsy, a follow-up PET scan. It's a source of stress and anxiety, and it can be overwhelming. And so sometimes costs keep people from completing their cancer treatment. And that's one thing you never want to see, is when they just drop away or they go to, alternative kinds of treatment that are much less expensive, but not going to be in their best interest for overall care and survival. So information to help you adjust your budget and financial guidance, creating a financial plan if you do have an accountant or financial planner, or if there's someone you can find in, I'm going to give you some examples of this later in resources, but there's a legal resource fund out of Loyola University. And these are lawyers who do free care and give free telephone conversations for 20 minutes at a time so that you can find the best source for you, particularly if it's going to lead to a financial or legal matter. We've had patients going through divorce, bankruptcy, child custody issues. These are the things that are just heartbreaking when you're also not feeling well. So I have that link at the end so that you can get some free online legal counseling should you need it. And then again, the best people to talk to about this is a case manager, a navigator, their advocacy organizations. Get the conversation started about resources. You just might want to say, this is really impending my care, and I really do need to speak to someone. Can you refer me, or is this something we can talk about now? So who can you talk to about these things? And what can family and friends do? Everybody wants to help, so please let them. So many times, patients, no matter men, women, we want to think that we are independent, we can fix things ourselves, we don't want to be a burden to anyone else, so we don't ask. Or if somebody asks, what can I do for you? Tell them what would be helpful. Making meals that can be put in the freezer, or offer to do some gardening, or do they need a ride to their appointment? Housekeeping. I used to do laundry for a friend of mine. It was just piling up. It needed to get done. I did the laundry. Pets for a walk, shopping, returning books to a library, picking kids up from school, even taking the kids out to dinner so that you can have a quiet meal at home. I mean, these are some practical ideas. One thing I will say is that sometimes people say, please call me if you need anything. Well, nobody really wants to do that. So I'm always telling people, don't offer, say to somebody, I know you like pizza. I can bring you a pizza on Tuesday or Thursday. Tell me what kind you like, and I'll bring it at what time should I bring it? Be specific. It's really helpful to help somebody with things that they really need. And I think these are quite common things. But here's not what to say. Oh, just live in the moment. I read about this new diet that cures cancer. I know you'll get better. I know what you're going through. I can't stop worrying about you. Please don't add another burden to my already heavy heart. And really, you have cancer? People mean well, and sometimes they're so afraid for you. Sometimes they're afraid for themselves. What if I get cancer? They start asking these questions to themselves. So you can't really understand what it's like being a cancer diagnosis unless you've walked in similar shoes. So I urge everybody, sometimes the patient has to be the one to say, this is not helping me, or please let's change the subject. We shouldn't have to be the ones to direct the conversation. So if friends are starting to say things that are really troubling, or they mean well and their hearts are good, but you maybe want to just say, this is not helping right now. So have you thought about any of these other kinds of things? Oops, sorry. Oh, what are the other things that maybe you might need at some point? Is getting transportation to and from a treatment and talking with your employer about your diagnosis. I have patients that don't want to share this with work. The first thing they want to do is just go to work, put on a wig if that's necessary. Some people are out in the field, they're realtors, they work at the front line of their businesses, and they don't want people to know. But sometimes, and you know the situation better than anybody, if you can talk to an employee and employer and take them into your trust, find out ways that you can work part-time, or work a limited schedule, or work remotely from home if that's possible. And then finding ways in which people can help you with uh, home care services or housekeeping, rotating the requests you need from family and friends, and legal services that are related to any of the personal matters that come up. So these are other sideline things to think about. And this is where you need to bring in your own community, because they say it takes a village, and it really does. So you do want to make sure that you've thought these things through, and then finding ways in which you can accomplish some of these through other organizations. So what can you do to help a patient? When my friend was going through cancer, she was home. I've just listed a few things that are really helpful. I'm sure you have other ideas when we open up to questions. But I just want to say that anything that can help a patient have a little luxury, a snack, stationery postcards, if they want to write in a journal, towels, fun hats or scarves, or socks if you feel cold. These are things that your network of people can certainly help you with. So here, I think the priorities are for patient-centered care. No one comes before the patient. Every patient is the only patient. And to enter through the patient's world, you have to see the patient through the patient's eyes. And this is from Don Berwick, an MD who works in an Institute for Healthcare Improvement. So I do want to recommend that. Here's the 8 things I think you need to remember overall: is talk openly with your doctor, get a second opinion, inform yourself about the type of cancer you have, and decide carefully on your treatment plan. That's where a second opinion may be helpful to you in that way. Be a smart patient, ask the questions, don't be afraid to ask the question, and take availability of every possible support service if you feel that's going to be helpful to you. And look at finances, look at ways that you can have financial assistance, and that helps you take charge of the future. Here's the organizations I was talking to you about. And I don't see the one I told you about. So this one's called Legal Resource Center at Loma Linda University. I'm sorry, at Loyola University in LA. So I would recommend that. The Patient Advocate Foundation is another good one, and they could probably help you in some of those things as well. Live Strong, I just want to mention quickly, they have an 8-week exercise program free of charge for those that want to stay healthy, have the stamina to do it. These are for cancer survivors, and very wonderful program given in Camarillo. We'd like to see it come closer to us here, but do check out Live Strong. They have a wonderful program for wellness, as does the cancer support community. So I want to thank you for listening. I hope this was helpful, and I'd like to open it for any questions now that you may have.